Okay, this is part 3 of our chapter 12 recording. The next 3 steps that we're going to talk about are steps 4, 5, and 6 in the prescription filling process. Step 4, of course, is generating the prescription label. The computer-generated label should be compared with the original prescription. Um, has the patient information been cross-checked? So make sure you have the correct name, the date of birth, are some examples. Are the label and the prescription identical? So with the medication information like the drug, the dosage, the concentration, the route, patient information, physician information. Are the leading and trailing zeros and unapproved abbreviations correct? Is everything double checked if needed? Do all of the data elements on the label match those on the prescription? So these are things, of course, that's going to help to ensure that there is no typing error or program malfunction that did not occur or alter the information. Step 5, retrieve the medication. So use both the original prescription and the computer-generated label when selecting a drug product from storage. Remember, drug lookalikes and sound-alike drugs, of course, can cause accidental substitutions, and it is important to use the NDC numbers when you're checking the in the drug name, of course, to verify selection of the correct product. Be aware of tablets and things like that that have the extended releases. Also, different types of cough medications may have different types of formulas. Confirm, of course, that information entered into the computer matches that in the original prescription. So, something to think about. Has the information on the manufacturer's label been used to verify the medication selection? So, verify the original prescription. Verify the shelf or the bin labeling. Verify the manufacturer's name. Did you verify the NDC numbers? Did you identify the brand and generic name available? So those are just some things to think about. Be sure the label and the product container match in terms of like the brand and name and generic name, dose, strength, and form, NDC number, and the manufacturer name. So an example, like your brand names, some examples of the brand name and generic name. Brand names like Adderall and Inderall are both, of course, from the same manufacturer. They also sound alike or look alike drugs, but they have 2 different generic names. The generic name for Adderall is amphetamine salts, and the generic name for Inderall is your propanol. So those are some things to think about. If you look at this picture here, you can see, of course, that some drugs have many formulations and combinations, and one is cough and cold medicines, and that's what we're seeing here. They, of course, contain the brompheniramine, of course, in both adults and children's medications, so you always want to check the NDC number to make sure that you're getting the right medicine or that you're picking the right medication off the shelf. Fill or compound prescriptions. Calculation and substitution errors, of course, are frequent sources of pharmacy-related medication errors. The text should write out the calculations and have a second person check their answer. Do not allow interruptions or distractions during filling and compounding. If you have to stop before filling is complete, then be sure to start over from the beginning. Okay, if it is a compound that's not going to allow you to stop for the interruption, just make sure that you finish the compounding first, then answer the question that someone has. All equipment should be maintained, cleaned, and calibrated regularly. This helps to, of course, to prevent technology errors and different types of malfunctions. When compounding, do not allow interruptions and prepare products one at a time. And also, I just thought about one thing. If you come back here, it says all equipment should be maintained and cleaned and calibrated. Calibrated is usually those automated machines, okay, that you need to make sure they're calibrated and cleaned regularly to keep them from getting working incorrectly. Things that you may not think about that you need to clean are the trays and spatulas used for to be should be cleaned, of course, to prevent like a cross contamination of drugs that may leave dust or powder on the tray. And usually those are like if you count a certain type of medication, maybe like a penicillin medication, sulfa, those are drugs that are common allergy causing medications, and they can possibly cause a possible contaminant to the patient's prescription. Okay, so penicillin sometimes it will leave a powder on the tray. If you count penicillin, you should clean the tray. That if it leaves a powder, clean the tray for the next prescription that you count. Okay, and you should always clean it with the isopropyl alcohol. Some things to think about: have the amount to be dispensed and the increment of measure verified. Check the original prescription. Count the medication twice. Okay, especially on your narcotics, you always want to make sure that you count a medication twice. Does the prescription require calculation or conversion? If it does, you want to write out the calculation or conversion and have another person review it. Has the equipment been calibrated recently? So you want to check the calibration and verify it with the patient, the pharmacist. So any type of equipment that needs to be calibrated, you usually have a checkoff sheet to show where you have calibrated it and double checked it. And what that does, it helps prevent the technology errors and technology malfunctions from happening. Does the medication require warning or caution labels? So check the patient information handout and the package insert and check with the pharmacist. Warning labels, of course, what they do for the patient is they serve as reminders to the patients about the most critical aspects of the drug handling or administration. Next step we have is steps 7, 8, and 9. The step 7 is review and approve the prescription. So the technician's work must always check the technician's work. So the pharmacist is the one to review and approve the prescription in the step. The pharmacist, of course, is legally responsible for verifying the accuracy of any prescription that is filled, and it verifies the end product. The pharmacist does. The pharmacy technician should provide all available resources that are useful to ensure accurate verification, and they're going to be vital, of course, to the patient safety. The pharmacist should be able to retrace the technician's steps in filling the prescription. Did the pharmacist review the prepared medication? They should always have the last check or the end check of product of the prescription. Given the information provided, can the pharmacist verify the validity of the prescription, the patient information, the correctness of the prepared prescription? So you want to make sure that the pharmacist reviews the hard copy prescription along with the label. It's important, of course, for that stock bottle of medication to be with the labeled medication bottle and the original prescription for the patient to verify the accuracy of it. Step 8, store completed prescription. So ensuring the integrity of the medications is an important part of medication safety. Many medications are sensitive to light, humidity, or temperature and must be stored appropriately. Failure to store these types of medications that have special instructions properly may result, of course, in the loss of the drug potency or its effect. One example of that is sublingual nitroglycerin tablets. They have to be kept, of course, in their original bottle, which is a glass amber bottle, because if you don't, the nitroglycerin molecules, what it does is it adheres to the plastic of the bottles and can cause the dose to have a lessened effect. So you always want to make sure that you keep the sublingual nitroglycerin tablets in its original bottle. A well-organized and clearly labeled storage system, of course, can keep a patient's medications together and separate from those of other patients. So some things to think about are the storage conditions. appropriate for the medication. These, of course, can be found in the package insert as well. Are each patient's medications adequately separated? So it is important to make sure that medications are with the correct person's bag. Okay. Um, and also, are these storage areas neat and orderly? If they're unorganized and all messy, it's going to be hard to find the correct medication, or the correct bag. So being organized and using an organizational system such as bins, boxes, and maybe a numbering system, or maybe a alphabetized system, can help prevent errors. In a community, step 9, of course, in a community pharmacy, the technician should confirm the patient's identity, usually by verifying, of course, the address or the date of birth. Okay, so when a patient comes into the pharmacy to pick up a medicine, you should always say, what is your date of birth? So you always want to verify the date of birth and the address to ensure you are giving them the correct bag of medications. So once the patient identity is correct, the pharmacy tech should tell them the number of medications they have or he or she may expect to have or receive. So, if Jane Doe come in and I said, I'd say, what is your date of birth and your address to verify it before I hand it to her. I'll say, did you have 4 medications? Because sometimes they may get called in at 2 different times, and she may say, well, no, I was supposed to have 6, so you need to go back to the bin and double check for more additional medication bags. So they can get put on 2 separate bags. So the show and tell technique can be used, of course, to prevent medication errors and provide patient education. So if the patient has questions about his medications, then the pharmacist should be consulted. The pharmacist is the only person that can cancel that patient and give them advice. When the patient comes in to pick up the meds, the pharmacist or the pharmacy tech can open up the vial and show the drug product to the patient. Okay, what that does is that step actually helps the patient to identify the drug he or she is taking. If it does not look familiar to them and they have taken it previously, then the tech needs to check with the pharmacist. And in some cases, it could just be that they switched manufacturers and the different manufacturers will shape the pill a little bit differently. Or what it's doing is it's checking for a misfill as well. So in a hospital setting, a nurse or caregiver is another person to confirm the accuracy of the medicine. And just a reminder here, pharmacy technicians cannot instruct patients. If a technician suspects that a patient requires instruction, the technician should alert the pharmacist. What a pharmacy tech can do is a pharmacy tech can show them their medicines and they can read them the information off the bottle, but they cannot give them any type of advice that needs to be given by the pharmacist. Some things to think about. Will the appearance of the pill be new to the patient? If it is new, they will tell the patient, the pharmacy tech or the pharmacist usually. So sometimes it could be, like I said earlier, a change in the manufacturer. So if it is different, you need to check with the pharmacist to double check it. Is the patient receiving the medication intended for him or her? Does the patient understand the instructions for use? If not, refer the pharmacist for verification and consulting. Does the patient know what to suspect or expect? So do they know the side effects, the adverse reactions, and so forth? Are all of the prescribed medications included? And then here's a question to think about. What are some of the potential medication errors that can be detected and avoided in the prescription filling process? And how do the pharmacy technician's role and the pharmacist's role in the effort differ? So those are some questions to think about when you're reviewing through the notes. Like pharmacist role, the pharmacist has the last check in the filling process. Techs will check after each step from each other. And there may be some additional things you could add to that, but that's just to get you started. And we'll end part 3 here.